So the RHA filler line is totally different than other hyaluronic acid filler lines. R stands for resilient, so it's resilient hyaluronic acid. What makes it different is most hyaluronic acid fillers, and we've had so many for so many years, you put them in the area and they actually look pretty good when you're not moving, in static lines. But as we move, as we create dynamic lines, the fillers don't move with them. Because the RHA line, the resilient hyaluronic acid line, is more natural, it actually moves when we move. So I think what the RHA line has brought to our practice is the next generation of hyaluronic acid fillers. We've been doing these for 20 years. People have been satisfied to a degree, always looking for the next thing. And they want things that are natural. This is the most natural hyaluronic acid filler made. They want fillers that integrate with their own hyaluronic acid. We all have that in our skin. And they want fillers that aren't going to disappear in just a few months. The RHA line, and that's RHA 2, RHA 3, and 4, can last up to 15 months. So there's really nobody who's not a good candidate for RHA fillers. We've used them on some younger people who just want to work on their lips or create what we call prejuvenation, and often that's the RHA 2 line. And we've used them on people, frankly, up to 80 years old, when you start getting to the more robust RHA 4 line. And so there's no person who couldn't get these fillers. The ideal person, though, is someone who has experience with previous fillers, previous hyaluronic acids, and says, not natural enough. They don't move with me. I want something that goes with me. So there's almost no area that we couldn't treat. There are some fillers out there that you don't want to use along the lips or in the tear trough area. The RHA filler line we can use everywhere. The RHA 2 line I tend to use around the lips or for finer lines, sometimes even crow's feet. The RHA 3 line is sort of a go-to filler for nasolabial folds or smile lines. And the RHA 4 line is for volume. So I use it on cheeks, below the eyelids to smooth things out. So pretty much any area can be treated with the RHA filler line. So the RHA filler line improves the appearance because it moves with you. None of us sit still and don't move. And so when you smile, when you grimace, you're moving lines. You want a filler line that moves with you. And that's what the RHA filler line does. There's really no downtime at all. We treated somebody today who was on some blood thinners, so she bled a little bit more. But in terms of true downtime, there's virtually nothing, and people can put makeup on it right after we do it. So today we're going to use what I would consider to be a revolutionary new type of filler called RHA. It stands for resilient hyaluronic acid, and it really is exactly what it sounds like. We've had hyaluronic acid or HA fillers now for well over 2 decades. I mean, most of our patients, including this one, have had them before. And they've been standard bearers for treating everything from lips to smile lines to cheeks and various areas of the face. The problem is those sorts of older hyaluronic acids, because of the way they're made, tend to be good for what we call static lines. That is, if you're not moving. They look pretty good. But then as soon as you start moving, as soon as you start moving your cheeks and your lips, they don't kind of go with the skin. And so they're not natural looking. So the RHA fillers, of which there are RH2, 3, and 4, and we will use them all on our patient, they really move with her. This is a very natural process. And the reason they're so different is the way they're made. The RHA resilient hyaluronic acid fillers are the most natural hyaluronic acid fillers on the market. It's the way they're cross-linked. They're made to be almost like our own hyaluronic acid, which we have in our skin. And so as we move, they move with us. And because they're so natural and they're so resilient, they tend to last up to 15 months, which is more than many other hyaluronic acid fillers. And so to me, the ideal patient for this is someone who wants natural, someone who wants the filler to move with them, And often it's a patient who's had other HA or hyaluronic acid fillers and wants to get something that is more natural. She's had some of these. She's going to love these fillers. So our patient is a perfect patient for the RHA filler line because RH2 I tend to put in areas where I need a soft fill. Not a lot of fill necessarily, but a softer fill. So for example, along her lips, I'll give her some RH2 filler, which is here. And then as we move up from RH2 to RH3 to RH4, we're going to give her some RH3 here. These are her smile lines. And then ultimately RH4, which really has the most resilience, as I call it, is strong. Great for her cheek lines, great under her eyes, and the same thing on both sides. And so this is a situation where I'm going to be using the resilient hyaluronic acid line, but the different versions of them in different areas because we'll get optimal results with each one of them. So this is RH2. We've cleaned her skin. I tend to use Lasersin, which is sodium hypochlorous acid. It cleans the skin, gets rid of all the bacteria. Put that needle on nice and tightly. And we're going to start off along the top of her lip, right here. Little teeny pinch, slowly, slowly. And we'll get a little tiny bit of a lift. Slowly. Now move your lips, go ahead, move them. See, it moves with her lips. It's just a very natural look. And we're going to go along the top of the lip, and what we're doing is we're going to lift up that lip, not so that it looks silly, but just giving it a little bit more body, a little bit more of a pucker, if you will. And you can see already the difference on one side as compared to the other side. And it's really very natural. Some of the hyaluronic acid fillers that we've had in the past create a lot of swelling. We don't see that with the RHA line, again, because it's just a natural hyaluronic acid. Put a little bit more on this side. And then we'll save that because we're going to go to the other side eventually. Now, we'll go to RH3. So that's the next up in the series. A little bit thicker. And I love this for the smile lines. So I start off and I go very slowly, small amounts. There's no rush. You can see how soft it looks. It doesn't look lumpy at all. The needles are tiny, the material is not that thick, so it's not uncomfortable for her. And you can already see the difference in how deep the lines are here to what's going on here. Instant gratification. Yeah, it makes happy patients. And again, the material is moving with her as she is moving. Look how natural that looks. And again, look at this side. I haven't treated there yet. So that's RH2 around her lips and RH3 in her, what we call nasolabial fold or her smile lines. Now we'll go to RH4. So we go up the ladder. We start with 2. We go to 3, and now to 4. And 4 is terrific for volume loss. And you'll see when I inject this area, it actually will make the whole area around her eyes look more natural. Let's start off right here. Very gently, slowly. Here we go. We've worked under her eye, and now you see she has really nice cheekbones, but she has volume loss here in her lateral cheek, which is very common. And so we're going to build that up some now too. And I inject fairly deeply, and you can see it's lifting it up immediately. And what I'm doing is I don't want to blunt the cheekbone to the cheek because that would not look natural, but I'm lifting this up somewhat. So we've treated the right side of her face, and now we're going to go to the left side of her face. And people always ask why it is that the product looks so natural. And it really has to do with the fact that the hyaluronic acid in the RHA fillers, because it is so natural, integrates with her own hyaluronic acid. So it's not like two foreign substances working away from each other. They're actually coming together, and that gives it a very natural look. One thing you may have noticed is we had a little bit of bleeding with her. And so often we try to have patients not take aspirin before the procedure, but some people have to be on blood thinners. She's on Eliquis. And so, that is something that causes bleeding. But you can see even with that, she's not getting that much bleeding. And I do treat people even with blood thinners if we can't get them off it. All right, so we've worked on her right lip. Now we have to work on her left lip. So we're back to the RH2 again. Teeny amounts, slowly. Teeny amounts, right along the edge of the lip, just to give her a little bit of a lift. There you go, slowly. Good. Just a tad better definition to her upper and also her lower lip. This is RH2. And so it's integrating with her natural hyaluronic acid. It's a marriage of natural hyaluronic acid from the filler and natural hyaluronic acid that's in her skin. Okay, so that was the RH2. Now we go back to the RH3 again, along her smile lines. And look at this smile line. And we're never going to be able to make them perfectly symmetrical because nothing in life is and nothing in life should be. But we're going to make it more symmetrical than it was. Slowly. And look what's happening to that deep smile line. Poof! It's gone. Just like that. Okay. So that's RH3. A little bit more at the top. Very good. Okay. And then lastly, back to the same issue on the other side. Look at the depth here. Look how nicely this is filled in. Look how natural even her lower eyelids look because of the natural RHA4 there. We'll do the same thing here, and we'll do the same thing here. In terms of totals, I used 1 syringe of RH2 on her lips and around her lips. I used 1 syringe of RH3 in her smile lines. And the RH4, because obviously it's a much bigger area, I will be using probably not quite 2 full syringes. And you can see how that's filled in so nicely. And what it makes it is she had a little bulge in her lower eyelid. That bulge now is essentially no longer there because of the smoothness that goes from her lower eyelid all the way down to her lips. And that's the more natural look that you see in younger people. And now some over here. Remember, she has the nice cheekbone. We don't need to go there. And we're slowly filling in this area as well. And she did it. You look fabulous.
Thank you. Can I see myself?
Sure you can.
Oh my God, I look great. Thank you so much.
You're welcome.
Oh my God.